Okay, so I'm talking to KT Gallager, the Director of Public Health in Dunn County, and I'm going to ask her some questions about today's order from the governor mandating face masks and how that'll affect Dunn County. So, KT, how do you think this will change things in Dunn County? A lot of businesses are requiring masks already. What do you see as the substantial change here?
I think the substantial change is that we are going to get that push from the public to go ahead and wear cloth face coverings in public if they were kind of on the fence before, recognizing that the state is asking us to keep our whole community safe. And this is one of the ways the data shows that we can do that. And so I think that this will support our businesses and it will support our whole community as we try to maintain the levels of infection that we see and not have a significant increase.
I was interested to see this afternoon that there was a statement from the Bank Association thanking the governor for regularizing this so they all can act the same way. And I think that's a big win for everybody. I've seen some concern today, particularly on social media, about whether people are going to get arrested and, fined. And I'm sure that in view of the fact that some of the police organizations or police entities around the state have had different attitudes toward masking in the past, we'll probably see some different behaviors in different areas as far as of police involvement in it. And I kind of hope it doesn't come to that. But clearly some people don't want to play. So do you have any comment about that?
Sure. That is the blessing and the curse of a home rule state. We have heard from the governor's office that enforcement at this point is going to be the same statute that gives enforcement responsibility and authority to DAs. And so there is a local flavor to enforcement. It is a civil penalty, so it's not like people are going to go to jail or be carted off. Of course, in public health, we always start with education as our primary and most effective tool as to why this is being asked of people and what the benefits are for them and for their community, and really trying to tap into people's goodwill towards their neighbor. But again, we are a home rule state, so it is up to our local DAs as far as how they want to enforce that civil forfeiture. And so I've had conversations with many of my law enforcement partners. I have meetings set up in the next couple of days with our county administration to really digest this, as well as our local DA to understand where she sits with this.
One of the things I was a little bit surprised, was surprised and not surprised by in the order today is that it only allows face masks and not face shields. So why is that?
Sure. So, this is one of those places where we're still getting data confirmation. And so there are some preliminary case studies that haven't been written up by a government agency, but it's starting to show what fluid dynamicists and air and particle physicists and all the really, really, really smart people know about aerosols and droplets. That there was I think it was in Switzerland, there was a group of service sector employees, and there's some preliminary data to show that there was a statistically significant difference between those servers at a restaurant, I believe it was, wearing masks versus face shields. And so what we know is that face shields are really good at keeping particles out of your eyes from large droplets, so if somebody coughs or sneezes, but they're not good for some of those smaller particles that are going to be lingering in the air around. And that's really where that protections from both source protection and the individual protection of a good tight-fitting face covering, cloth face covering or surgical mask are an improvement over a face shield. I do understand that there are some very specific situations where it's very important for folks to see someone's face, especially for the hearing impaired. And I understand that difficulty, but as far as disease transmission, it's starting we're starting to get a picture that they just don't compare the same way as far as protections go.
Okay, that seems sensible. I think one of the big concerns people have right at the moment, of course, is the opening of schools and
Mm.
where we are heading with that. And the current plan, at least from the nominee school district, doesn't necessarily mandate the wearing of masks in the classrooms. And so, have you had any talks with the school district about? I know it's just been a couple hours.
I was gonna say, so Steve, not in the last hour. I can honestly say I've not talked to any of my school districts in the last hour. But we have talked about cloth face coverings and mask use. I was really happy to see that many of our school districts here in Dunn County actually signed on to a multi community partner request for the state, I'm sorry, the county board last night to do something with more oomph around requiring mask use. And so that did include the Menominee Area School District as well as Elk Mound and Colfax. And so I know with conversations that we've had in general and predating that they want to do what's best for their whole community, including their staff and their students. And that if I asked for a mask advisory or a mask order, that they would work to comply towards that. Like I said, I haven't had an opportunity to talk to them since this has come out from the state, but I know that we'll have conversations about how we can implement that to keep their whole community safe and also address people's concerns about pre-K, so kids under 5 years old, as well as individuals that may be at high risk and feel uncomfortable because of health reasons to not wear a mask. I would also be significantly concerned about folks that have health reasons to not wear masks, whether or not they should be in a high risk situation out in public or if they should be really self-isolating safe or self-quarantining safer at home if they've got medical reasons that make mask wearing very difficult for them.
Sure. Okay, is there anything else you would like people in Dunn County to know about this or about COVID-19 in general right at the moment? Or any other public
Sure.
health issues for that matter?
Oh, yeah, I think I do owe people a press release on Eastern equine encephalitis, but let's keep this at COVID. So we are seeing a significant uptick in cases. We are at 100 cases here in Dunn County. And we're seeing significant activity in our adjacent counties. And so COVID doesn't stop at the county line. Many of us do business, we play, or we go to school in adjacent counties. And so it's really important that we reduce our activity levels, especially if we don't have to go out, that we reduce the size of our circle to go back to predominantly our household contacts. When we bring in our larger family units, that does increase our risk of exposure and it increases our risk of sharing our germs. We have seen locally multi-generational families impacted with COVID infections. And so one of the ways we can do that is by making our circle smaller. And all the things that we've been talking about for way too long now. Good hand hygiene, wash your hands before you eat, wash your hands or use a hand sanitizer anytime they become contaminated. Stay home if you're sick. It sounds pretty simple, but you'd be amazed at how many people have low-grade symptoms of COVID and they're out and infectious. Something else that has really bubbled up is stay home after you're tested. So if you have a reason to go get tested, either you know somebody who has COVID-19 or you've got some symptoms, even if they're mild, like loss of taste or smell or headache, low-grade fever, that kind of thing, and you go get tested, you need to stay home until you know your results. We've had a couple cases here recently where they were handed a packet from the provider that did the test, but they weren't verbally told that they needed to stay home. And so they didn't. And so we have workplace exposures and we have friend group exposures in a very different way that could have been prevented if they had stayed home after they were tested. And so I think that those things are all very important for everybody to know to keep themselves safe. Practice those non-pharmaceutical interventions. Stay home when you're sick. Stay home after you're tested. Wear a mask, cloth face covering when you're out and about doing those essential activities that we all need to do. And keep our businesses and our schools safe so that we can continue to stay at this level and not have the forest fire of cases that we're seeing in some of our adjacent counties.
So mostly the same things you've been saying right along, just with a little more emphasis on masks.
A little more emphasis on masks, but all the same things. Stay home when you're sick, wash your hands, wash your hands, wash your hands.
All right. Well, thank you very much for your time today, KT. I'm sure you're really busy, and I'll let you get back to work, and I can get back to making dinner.
All right. Take care, Steve.
Thank you.